hi. Could you tell me what is your name and where do you live?
Okay, my name is Claude Etelgi Katz, and I live in Penfield, 28 Milford Crossing in Penfield.
Yes. Could you tell me what was the reason when you came to us?
I came here because for quite a long time I had been in pain for my left hip, and then I ended up having a hip replacement on the left side, and then and I still have pain on that side, and I started having pain in the other side, and I was looking for some alternatives way because I really the left side is much weaker than normal, and it bothers me when I go up the stairs. So I decided to try with you, and it worked out really well. I was in so much pain I couldn't sleep at night.
You could sleep at night.
And that's depressing because you think, oh, am I going to stay in pain for the rest of my life? And I'm so tired in the morning because I really, really need to sleep. But
so you're tired in the morning because you're unable to sleep.
Right, but that pain, so now you give me this treatment, and slowly, my pain is gone.
Is gone?
Almost gone. It's rare that I have a little bit of pain. I was starting to have pain in the hips and in the shoulder and in the knees, and I was like, what am I going to do? Become a robot to change all my joints with metal? So I was really scared.
So how much pain is gone? I would say 90% gone, more than 90% gone?
95%
95% gone,
yeah.
That's okay. And for how long it took, how many months you are with us?
I think we've been together for 6 months.
6 months, okay.
Yeah.
And you were telling me about you can also lift your grandkids,
yes,
but
of
you're not able
course.
to
I'm
do that.
back to a normal life, so I can enjoy
Back to
lifting my
life.
grandson. It's really a problem if you can't go up the stairs with your grandchild because he's a baby.
Yes,
and his bedroom is upstairs. So it really impacts so many parts of your life when you're in pain.
It's
really
impact a lot of
awful.
life, yes, when you're in pain.
It's awful. So I'm really
You're happy now? So
when you gave me these medications, I was like, I'll try. What do I have to lose? You know. But I'm very happy.
So
now.
you're very happy. Do you recommend us to the other patients?
Yes.
Okay.
Yes.
And can we share your testimonials to the other patients?
Yeah, sure.
Okay.
Sure.
And did we press you to give the testimonials? Are you giving on your own, volunteer?
No, of course I'm glad to help other people. Yeah.
Okay, so you're not any way you are coached or you are.
No, actually I recommended you to another friend
You did
who
recommend
had a hip replacement too,
okay.
and she's miserable because her other side is starting to hurt. So we want to go a different route.
Different route. Thank you, and thank you very much for giving your testimonials. That's right. So that's our passion. You see, that's what we want to see, the people smiling. Resolve their health issues. Okay.
Yeah. Once you lose your health.